Well, thank you. As mentioned, I'm going to be talking about continence drugs in the older patient, or the impact of aging on the response to drug treatment. And no disclosures. So we know that aging is actually the largest risk factor for a number of age-related diseases. There are a number of changes. There are changes in kidney mass, metabolic rate, cardiac output. The elderly and the frail elderly are much more prone to electrolyte disturbances. And in general, there's actually a progressive decline in reserve organ function as we age. We're much less able to respond to everyday stressors. Aging actually has a profound impact, as we know, on lower urinary tract structure and function. There are changes in collagen content, post-steroid residual, reduction in contractile function, filling sensation, bladder capacity, a number of other parameters. And obviously, aging is a continuum, so this affects everybody differently. But taken together, aging can lead to changes in urinary frequency, urgency, incontinence, and even nocturnal polyuria. This shows the prevalence of urinary incontinence as it increases in age. And so this chart is the prevalence in men and women, 85 years and up. And obviously there are a huge number of changes from nocturia, overactive bladder, and so forth. And the most common lower urinary tract symptom thought to arise with aging is overactive bladder. And this panel is from one of Chris Chappell's reviews. So lower urinary tract symptoms may be due in part to oxidative stress. Obviously, there are a number of factors, but oxidative stress plays a huge role. There are multiple changes in the brain. This can lead to urgency and dysregulation of bladder control, changes in the muscle, loss of muscle tone, ultrastructural changes that can occur over the years, which can lead to muscle damage, ischemia, and even changes in the epithelium, both the bladder and urethra, which can increase inflammatory mediators, and even the loss of the mucosal seal, which plays a role in incontinence. So taken together, this can result in a huge number of lower urinary tract symptoms. So mitochondria is an area that my lab is interested in, and a number of others as well. And so mitochondria, the powerhouse of the cells, they generate the bulk of ATP necessary basically for us to survive. But they're also a major source of reactive oxygen species, or ROS, which is oxidative stress. Once generated, this excess ROS is damaging to cells. It's mainly damaging because exactly where it's produced is next to the mitochondrial DNA. And the mitochondrial DNA really doesn't have a way to repair, so of course you have cellular damage, organ decline. So just a few examples what aging can impact. It can impact the extracellular matrix. There are a number of age-related changes in the structural environment of the matrix. On the left is a panel showing this is multiphoton imaging, so the red and slightly orange, this isn't actually staining, this shows the collagen fibers throughout the bladder wall. Oxidative stress can obviously lead to inflammation, and chronic inflammation can lead to fibrosis, resulting ultimately in a very stiff tissue. Aging can certainly impact the muscle, can increase the incidence of LUTs and incontinence. And again, the mitochondria are the powerhouse. They're the muscle powerhouse. Aging muscle develop a number of abnormalities in mitochondrial number, function, and structure. And the absence of a single mitochondrial protein has been shown to actually spur muscle aging and sarcopenia, which is a big problem in the elderly, especially in nursing homes. Well, another example is aging along with increased oxidative stress, mitochondrial dysfunction, can cause vascular damage. This can lead to increased ischemia and increased leakiness. And while we can actually evaluate this in the bladder, we can't see it. So here's an example which you can see, age-related macular degeneration, huge problem. There are abnormal vessels, abnormal vessel formation. These become very weak, the walls become weak. This can lead to leakage, and obviously then on the right, if this is not corrected, and if it's caught early enough with lasers, it can be, but if it's not, it leads to loss of central vision, and this is irreversible. So what about the treatment? Well, as Carl Eric mentioned, there are a number of treatments for urge, mixed UI, and also OAB, beta-3 agonists, antimuscarinics, but the older adults can be much more prone to side effects, in particular anticholinergics. And that can be due to a whole laundry list of possibilities, including deficits in neurotransmission, a change in receptor distribution, and obviously multiple pharmacokinetic changes as we age, including slower metabolism, a change in elimination of drug. The elderly are much more prone to cognitive impairment in general. There are a number of changes in terms of the junctional integrity of the blood-brain barrier. And from this slide, you can see that there can be an increased leakiness, so now drugs get access, and this can play a role in a number of drug-associated cognitive impairment. And anticholinergic drugs have been shown to either cause or contribute to delirium in the older adult. And as we know, delirium is a state of acute confusion. It can last for hours to months. It's much more common in the elderly, but it's hugely common in the hospital situation. And people with dementia are highly susceptible to cognitive effects of anticholinergics. So what are some of the future directions for treatments? Well, Carl Eric listed a number of these. I'm just going to throw out the possibility for a role of antioxidants in the treatment of age-related disorders. Here, in terms of aging, you can have an overproduction of free radicals coupled with a low level of antioxidants, so there's an imbalance. This, in general, can cause cellular damage and certainly contribute to a number of age-related diseases. So what about mitochondrially targeted antioxidants as a therapeutic? Well, actually, they do show great potential because they cross the mitochondrial phospholipid bilayer. They actually can eliminate loss at its source. Now, there aren't any clinical trials in terms of urology, but there are in Parkinson's, ALS, MS, hepatitis C, and myocardial infarction. So this is a really hot area for treatment, and that's something that we're beginning to explore as well. So in summary, increased oxidative stress, declining mitochondrial activity are definitely hallmarks of the aging process. These and other age-related, disease-related contribute to actually the elderly to increased adverse drug responses. The use of multiple drugs, especially in the elderly, the frail elderly, they can take multiple medications. This can obviously result in drug-drug interactions. This, as we know, heightens side effects, such as cognitive changes. And so mitochondrially targeted antioxidants, they're just one example that show great promise, but there is a need for validated biomarkers to actually assess this protective effect of these potential treatments. And I'll stop there. Thank you.